It's the way we play. Drink responsibly.
Good morning, Sinkinson News, and welcome to Inside the News right here on WinFM 98.9. It is 4 minutes past the 11 o'clock hour, and today is Saturday, January 14th, 2023. I am your host for today, Devon Cornelius. We have in studio with us today Dr. Hazel Laws, the Chief Medical Officer. Good morning, Dr. Laws, and welcome to the studios of WinFM 98.9.
Good morning, Mr. Cornelius, and thank you for having me and allowing me to participate in today's program. It's a privilege.
Awesome, and thank you so much for accepting the invitation. So, as advertised on our social media platforms, we are here this morning to speak about respiratory infections, including COVID-19, and of course, in your capacity as the Chief Medical Officer, you will, of course, get the opportunity to educate the listening audience about respiratory infections. And, of course, COVID-19 is still with us. So, explain in detail what influenza is and its symptoms. We know that a number of people have been complaining or have been saying that I think I have COVID or I think I have the flu. Tell us about that.
Okay, very good question. And so over the past few weeks in the Ministry of Health, we recognize that there is a gradual increase in the number of persons who are complaining of flu-like symptoms. Some have tested positive for COVID-19 and some have tested positive for influenza. So influenza, let's focus now on what influenza is. Influenza, otherwise called the flu, is a common respiratory tract illness that occurs during the winter months. Well, in St. Kitts and Nevis, that refers to between the month of November, December to March of the following year. So the flu is an acute, meaning it comes on suddenly, respiratory tract infection that comes on suddenly, and it's highly contagious. It spreads easily. It is caused by the influenza type A or type B viruses that are circulating globally and in the Caribbean sub-region. Now, in the Ministry of Health here in the Federation, we have objective evidence that influenza type A is currently circulating in the Federation. At this time, today, January the 14th, I'm unable to tell you the specific subtype of influenza type A because we are currently awaiting results from the Caribbean Public Health Agency or CARPHA. So we do have influenza type A virus in circulation locally. So now what are the signs and symptoms of the flu? So persons who have the flu often experience some or all of the following symptoms. They may complain of a fever, which can be very high, especially in children, sore throat, coughing, stuffiness of the nose, or even runny nose, aches and pains in the body. So either the muscles may be aching, or they may even be experiencing joint pains. Some complain of headache and even dizziness on getting up or standing, chills, extreme cold, feeling cold, loss of taste sensation and appetite, a general weak feeling or feeling of malaise or fatigue. Some even experience vomiting or diarrhea or lack or loss of appetite. So these are the main or the common symptoms of influenza or the flu. But you recognize, Mr. Cornelius, that these signs and symptoms are are quite similar to COVID-19.
Right. Now, as you spoke about influenza, what age group is at risk for contracting?
That's another good question. Anyone can get the flu. Okay, so children 0 to 17 years can pick up the flu. Adults 18 to 64 years can pick up the flu. Older adults, persons over 65 in their 80s, can pick up the flu. But when you look at the data coming out of CDC data seems to suggest that children younger than 18 years are more than twice as likely to develop symptomatic flu virus infection versus older adults, persons 65 years and older. So anybody can pick up the flu, but the children, we need to be mindful, monitor the children who are experiencing flu-like symptoms.
Wow. All right. Now, you stated earlier that the symptoms with COVID-19 are often similar to that of influenza. Can you explain in detail the similarities and differences between the flu and COVID-19?
That's a hard question, to explain the differences. They have so many similarities, So, for example, both conditions, meaning the flu and COVID-19, are highly contagious. And however, one major difference, they are caused by different viruses. So we know COVID-19 is caused by the SARS-CoV-2 virus that was first identified by the World Health Organization in 2019. And the flu, which has been around for decades, is caused by the influenza viruses. As I mentioned earlier, types A, B, and C. There's a type C, but we're not too concerned about the influenza type C because that virus only gives you like a mild illness.
Okay.
So that's the main difference, two different viruses. Now, both diseases spread similarly, which I'll explain further on. And another similarity is that we have vaccines to prevent and control both. So, as you know, during the past 2 years, we've been rolling out administering the COVID-19 vaccine, which is available. And from 2018, the flu season in 2018, 2019, we rolled out the influenza vaccine. So between 2018 and now, the Ministry of Health and the Federation of St. Kitts and Nevis have made available to our people the influenza or the flu vaccine. So let me just repeat, anyone interested in consenting to the flu vaccine, it's readily available through all health centers in the Federation. Can I use this opportunity to speak specifically to our older adults, those with diabetes, hypertension, asthma, heart disease, and even renal disease, those on dialysis. If you have not yet received the influenza vaccine, please think about it seriously because it helps to prevent you becoming ill from the flu, and it protects you from the complications of the flu. So, Mr. Cornelius, you cannot really tell the difference between the flu and COVID-19 by merely looking at the signs and symptoms exhibited by the ill person. So, in other words, if I present to the emergency room with a fever, coughing, runny nose, and even loss of appetite and aches and pains, the ER physician cannot look at me and say, look, you have the flu versus COVID-19. You
Right.
have to be tested for us to be sure, which one you have contracted.
How long symptoms appear after exposure or infection?
Okay, so that's another good question. So, if you are exposed to the flu virus, the influenza A virus that is in circulation, the incubation period, the period between exposure to the time when you exhibit symptoms, can be anywhere between 1 to 4 days. In terms of COVID 19, in 2020-21, the incubation period based on the original strains was longer, to 7 days, 14 days, between exposure and exhibiting symptoms. However, the Omicron variant is the predominant COVID 19 or SARS CoV 2 variant in circulation in the Caribbean and globally. And the scientific data has shown that the incubation period for the Omicron variant of SARS CoV 2 is much reduced. So it is similar now to the flu. So it's about 1 to 4 days between exposure to the Omicron subvariant and when you exhibit signs and symptoms. So that's one similarity now between the flu and the COVID-19. But please note that it is possible to be infected with the flu virus, influenza type A, or even COVID-19 without experiencing or exhibiting any signs or symptoms. So you could be asymptomatic.
Right.
In terms of the flu, most persons recover within 1 week. And I must say, over the past 4 or 5 months, during the circulation of the Omicron subvariant, persons have been able to recover on an average within 7 to 10 days from the COVID-19 Omicron subvariant infections.
Okay. With regards to the flu, how is that spread?
Okay, like most respiratory tract infections, the experts believe that the flu virus is spread mainly by droplets given off by persons who cough, sneeze, or even through talking, singing. Yeah, these droplets land on the mouth, the nose of the individuals nearby. You could also pick up the flu virus or even COVID-19 by touching high touch surfaces that are contaminated by the virus, because the virus remains viable on these high touch surfaces for a while. So doorknobs, countertops when you go to the bank or when you go to the utility company to pay your bills. So you got to be mindful of washing your hands right after touching these high touch surfaces, because inadvertently you can put your contaminated fingers into your nose, mouth, eyes, and there you go. You would have been exposed to the virus.
Tell us about the complications of the flu.
Okay, so some persons who contract or pick up the flu are at high risk of progressing or developing the complications of the flu. So, what are these complications? Ear infection. So, you can have serious or significant pain in your ears. Your ears can feel clogged, and you may need a course of antibiotics. You can develop sinus infection, severe stuffiness, difficulty breathing, or you can develop lung infection or what we call pneumonia. With shortness of breath, reduction in your oxygen saturation, etc. And if you're an older adult with an underlying chronic medical condition like asthma, heart disease, diabetes, your condition can be worsened while experiencing the flu infection. Now, persons who are older and have these conditions, you have to be mindful because you are at risk of developing the complications of the flu. And so that's why a minute or two ago, I sort of spoke to those individuals who are older with underlying chronic conditions. Think about consenting to the flu vaccine because it protects you from the infection and it protects you from developing the complications if you do pick up the flu infection.
All right. It is 18 minutes past the 11 o'clock hour, so we'll take a break to give a shout out to our sponsors, and when we come back, we will continue Inside the News right here on WinFM 98.9. Let's take a break, and we'll be right back.
WINN is 98.9. 98.9 is Win FM.
Buying your medication is easy with City Drug Store's curbside pickup. WhatsApp our certified pharmacist at 662-8769 with your requests. For prescriptions, take a clear photograph and send for review. We will engage you in dialogue and then provide a quotation and link for payment. You can then pay via TDC's online payment portal. And once the transaction is complete, you'll be notified that your pickup is ready. Yes, it's that easy. Send your WhatsApp message to 662-8769 to order your medications today with City Drug Store's curbside pickup service.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
Welcome back to Inside the News. It is 11:21. I'm your host for today, Devon Cornelius. We have in our studios today Chief Medical Officer of St. Kitts and Nevis, Dr. Hazel Laws, and we are on the topic respiratory infections, including COVID-19. Dr. Laws, let us continue this conversation. Can you summarize for us the treatment of the flu and tell us about the flu vaccine?
Okay, so if you are ill with the flu and it has been confirmed, your primary care provider would recommend that you get adequate rest, sleep, rest, and fluids. So drinking water is very, very important when ill with the flu. And based on the signs and symptoms you're exhibiting, so if you're experiencing muscle aches and pains, joint pains, and even a fever, your primary care provider will recommend over-the-counter anti-inflammatory medication or even anti-fever medication like paracetamol or ibuprofen. Now, those older adults who end up in the emergency room, they may have to be hospitalized. So those individuals who would have had probably asthma, diabetes, heart conditions, underlying chronic conditions, and who are experiencing the more severe signs and symptoms of the flu or even the complications like pneumonia, they would have to be admitted. And then the internal medicine specialist may opt to give them Tamiflu, which is an antiviral medication. So really, in general or in summary, the treatment of the flu is symptomatic. You treat the symptoms. Those who are very ill may have to be hospitalized, get IV fluids, hydration, and antiviral medication. So a little bit about the flu vaccine. As I said before, I want to underscore that the flu vaccine is available locally and it can be accessed through any or each of the health centers in St. Kitts and in Nevis. Now, the flu vaccine I've taken it myself, and what did I experience? Local pain, tenderness in the injection site in my arm after taking it, and there was a little bit of malaise for a day or two after taking the flu shot. But then I didn't come down with the flu for that winter period. So in other words, the complications or the side effects of the flu vaccines are quite minimal, similar to any of the other vaccines we give to our children. And as I said before, it's available through each of the health centers in the Federation. And I want the older adults with chronic underlying conditions, asthma, diabetes, renal disease, heart conditions, think about it, consider it. My mom, she reminds me when it's time to take the flu shot. She developed a bad lung infection, pneumonia, many years ago, and she has recognized the value of taking the flu shot. So every November, she takes the flu shot, and it protects her for the winter period. So even if she picks up the flu, it's mild, and she doesn't have to worry about the possible complications.
Right. What steps are being taken at the ministry's level to monitor and or track influenza?
Okay, very good question. And so within the Ministry of Health, in our Health Information Unit, we have a national surveillance system. And so through our syndromic surveillance system, we monitor on a daily basis anyone who presents to any of the health centers or the urgent care facilities, the hospitals, Mary Child's, Parkson, anybody who presents with a fever along with respiratory symptoms. So if we see an increase in persons presenting with fever, respiratory symptoms, it puts us on alert, and then we test to figure out what's in circulation. And so we have stepped up or ramped up our testing. And so at the JNF lab, we have the combo kit that is available to test for the three viruses at one go. COVID-19 tells you the type of flu virus, if it's A or B, and it also tests or tells us if you have RSV, which is respiratory syncytial virus. So testing persons who present to the ER with respiratory symptoms utilizing the combo kit that's now available at the JNF lab. So we note, as I begun, a gradual increase in persons testing positive for COVID-19 and a number of persons testing positive for influenza A virus. The specific subtype of the influenza A virus, we are still awaiting from Caribbean Public Health Agency.
Awesome. Now, can you tell us about the statistics as it relates to COVID-19? As I mentioned earlier, COVID-19 is still with us.
Yes.
I was watching the news the other day, And I was quite surprised to see that, statistics is still available. Countries are still tracking COVID-19.
Yes.
I know, particularly in the region. So what can you tell us about the COVID-19 statistics?
Okay, so in the Ministry of Health, we continue to track and monitor the COVID 19 situation locally. And so within the past week, January 6th to January 12th, 2023, we have identified or we have had 5 newly diagnosed cases of COVID 19 in the former laboratory system, meaning testing either at the JNF lab or any of the private labs within the Federation. I want to pause and say that a number of persons have been testing positive with COVID 19 outside of the former laboratory system, because almost every pharmacy within the Federation now sells the COVID 19 home test kits. So a number of persons are just going to when they experience the respiratory symptoms, they're going to the pharmacy, purchasing the test kits and doing it at home. And some of them are also positive. So we are not capturing those positive cases. So when I say within the past week, we have 5 newly diagnosed cases of COVID 19. This is not a resemblance of the true picture, because a number of persons are testing using their home test kits available at each of our pharmacies locally. Yeah? Within the past month, we have confirmed 17 new cases in the former laboratory system. So to date, as a federation, we have reported 6,579 positive cases for COVID-19, most of whom recovered. So currently, we are only monitoring 10 active cases. Now, in terms of the COVID-19 related deaths, it remains at 46. And in terms of hospitalizations, I want to share with you that we currently have 3 COVID-19 positive cases admitted at the JNF General Hospital. In terms of our vaccination, COVID-19 vaccination program, 57.2% of the total population is fully vaccinated. I want to underscore or inform the public that the COVID-19 vaccine is out of stock. As the Ministry of Health, the government, we are trying our very best to access the next batch of COVID-19 vaccines. It's very difficult or challenging to access COVID-19 vaccines, even in January 23. Now, however, we have the flu vaccine available. Now, in terms of the COVID-19 subvariant in circulation in the Federation, I cannot say specifically because we've only had a few cases, and neither of them met the criteria to be sent on to CARPHA for genomic sequencing. But now that the number is increasing, I'm sure that we will be able to send off some samples so that we can be specific in saying, what specific subvariant is in circulation. However, what I can say is that the Omicron variant is the predominant variant in circulation in the Caribbean, and this is based on data and information coming out of the Caribbean Public Health Agency. And information coming out of PAHO WHO tells us that the Omicron variant is the predominant variant in circulation globally. Let me just add.
Go ahead.
There's a lot of talk about the XBB.1.5 Omicron subvariant. Now that's the latest subvariant, and the WHO, Pan American Health Organization, they are monitoring the increase in cases as a result of the XBB.1.5, which is the most contagious subvariant to date. However, so far, the scientific data shows that the disease caused is not worse than, before.
Okay.
Yeah, so it's just it's the most contagious, so it's spread very easily. But, preliminary data is showing that it doesn't cause severe disease. So I had to mention the latest subvariant XBB 1.5.
Thank you so much. And I saw via social media where people were suggesting that we have that variant here. Can you speak to that? Is that the case, or
As I said, I
Okay.
can't say specifically
Okay.
which subvariant is in circulation here.
okay?
Remember now, the XBB 1.5, they've picked it up in the US, across the US, and in Europe. I do not know if CAFA has picked it up in any of the
Okay.
samples as yet. But in the ensuing week or two, we will know for sure if the XBB 1.5 is in our subregion.
Awesome. You're listening to Inside the News right here on Win FM 98.9. It is 11:34 here in our studios. For those of you who are just tuning in, we have in our studios Dr. Hazel Laws, Chief Medical Officer, and we are on the topic respiratory infections, including COVID-19. I know a number of you have been coming down with the flu. And so this is the program for you to get all the information, all the questions that you have answered. We'll take a short break to give a shout out to our sponsors. And when we come back, we will continue Inside the News right here on WinFM 98.9. Let's take this break and we'll be right back.
We're different. We're 98.9. 98.9. Win FM.
If you need protection, you need one who you can trust to secure your investment. You need one who'll do you just. TDC Insurance, you're the one that you can trust. TDC Insurance, you're always safe with us.
TDC Insurance is your go-to insurance company for all your insurance needs. We take pride in offering you the best solutions and ensuring our customers are fully satisfied. TDC Insurance, we take good care of you, guaranteeing you peace of mind.
You're always safe with us.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
Welcome back. This is Inside the News right here on WinFM 98.9. It is January 14th, 2023. It is 11:37 here in our studios. We have on the panel with us Dr. Hazel Laws, Chief Medical Officer of St. Kitts and Nevis, and we're on the topic respiratory infections, including COVID-19. Again, Dr. Laws, thank you so much for accepting the invitation. It is quite timely. As I said, a number of people have been coming down with the flu, and everybody have been giving their own explanation as to what the flu is and who has COVID and who has the flu. But I'm so happy that you're here with us today to bring the facts. Thank you so much for joining us. Now, countries have imposed travel restrictions on China. I've been following the news there, and I was surprised to see that China is still battling heavy with COVID-19. Will St. Kitts and Nevis impose similar restrictions?
Okay, so we've been getting that question also in the Ministry of Health. But very good question. So China had a policy whereby they didn't allow the virus to spread throughout the communities, and so the population did not have immunity against SARS-CoV-2 virus. So they lifted their restrictions, and so the virus is spreading, and so they've had a rapid increase in the number of positive COVID cases and an increase in the number of deaths between December to now, January 23, and that's in China. And so some European nations and the US, they require travelers directly from mainland China to provide a negative COVID-19 test upon arrival. However, let's pause and look at the COVID-19 variants in circulation in China. The Omicron subvariant BF7 and BA5.2 are the predominant variants in circulation in China. And if you were to do the analysis, these Omicron subvariants are also in circulation in our source markets and other territories globally. Yeah? And so please also note there aren't any straight flights between mainland China and the Federation. So persons traveling from China, they would have to go to a European port or a US port before traveling on to the Federation. So they would have already submitted their negative test to get into that European or US port before traveling on to the Federation. So based on the foregoing, there is no need to place restrictions on travelers coming to us from China at this time. The Ministry of Health, however, it's important to note that we are monitoring these developments and we will update the general public accordingly.
What about other source markets? Is there any reasons to impose any restrictions?
No, because
Okay.
the subvariants, that's it. There is the Pan American Health Organization, the World Health Organization. They are monitoring through genomic sequencing and genomic sequencing surveillance. They are monitoring the subvariants that are in circulation in the source markets, and they are similar. As I earlier in our interview, I said the Omicron variant and its subvariants are the predominant variants of SARS-CoV-2 in circulation globally. So no, the short answer is no, not at this time.
Awesome, thank you so much. I asked because, again, social media, and we know the challenges with social media, and we have the social media doctors and medical doctors and everybody coming and saying, I remember seeing a text that we're going to have travel restrictions from next week and the country is going to go into lockdown and all kind of things. So I'm really happy again that you can come here and
I
state
think
the
what we
facts.
and I also highlighted our high vaccination coverage rate, and
Yes.
it's important to note that yes, 6,579 persons have had, we've had, cases, we've reported, and a number of other persons in our community have had COVID. So we have vaccine mediated immunity and natural immunity amongst our population. So the federation, the population is protected to a good degree.
Awesome. Dr. Laws, back to influenza, the flu. People have been asking. I had a conversation yesterday with a colleague about about people who are coming down with the flu. And basically, the conversation was, is there a hotline? What should you do if you are experiencing flu-like symptoms? Do you stay at home? Who do you call? What's the next step? I know during the height of the pandemic, when the COVID cases were coming in like hot bread and butter, there was a hotline or something. Is
Yes.
it the same thing?
Okay, so no, as I said before, we have a good, level of immunity in our population. So we're not too worried about the gradual increase in the number of COVID-19 cases. And the increase in the influenza cases isn't unusual. We see this normally every year, even pre-COVID. And so at this time, no, there isn't a hotline. However, I think we are all now accustomed to calling our primary care provider if we are experiencing respiratory tract symptoms. This has been the recommendation over the past 2 to 3 years. So persons who had symptoms of COVID, you didn't just go into the health center or you call your primary care provider, you explain what is happening and express your concerns, and you would be provided the relevant recommendations. So the short answer is no, we do not have a hotline. Based on the numbers, it's not necessary as yet. Again, we are monitoring, but persons, you have the facility of calling your regular private physician, regular primary care provider, who may be a private physician or the district medical officer or the nurse manager at the health center in your community. And so a primary care provider is just a WhatsApp call, a WhatsApp message away. And so you can call, make contact, express your concerns.
I just got a question on my WhatsApp there. Are there, for the 10 active cases that you listed earlier, I think you mentioned 3 are currently admitted, right? Is there do you still have like a quarantine site in place? Those things are of the past? Or?
Yeah, of the past,
Okay,
basically.
okay.
No, let me be specific.
Okay.
However, this policy remains: if you are COVID positive, you must self-isolate. Let me just repeat,
Yes.
underscore. All the active cases, they are in self-isolation. So once you test positive, we recommend that you self-isolate. So those 10 in the formal system, they're being monitored by our case managers virtually. They're in self-isolation, and they will be asked to do a home test at the end, just for us to note that they would have recovered. So that we would ask them to do their home test and send us the negative result from the home test kit. They take a picture and send it to us, and then we would confirm that they would have they are recovered. Yeah. And so let me just say this.
Sure.
So those who are experiencing respiratory symptoms and who would have gone to the nearest pharmacy and bought a home test kit and test positive for COVID using the home test kit, we are recommending and pleading with you to self-isolate at home for at least 5 to 7 days, retest. And then once you test negative, you can go back into circulation.
Awesome. Dr. Laws, it is 11:47. We will take an ad break, and when we come back, we will begin. Let's take this break, and we will be right back. You're tuned into Inside the News right here on WinFM 98.9. I'm your host for today, Devon Cornelius. For those of you who are just joining the program, we have Chief Medical Officer Dr. Hazel Laws, and the conversation is surrounding respiratory infections, including COVID-19. We'll take a break and we'll be right back.
We're different. We're 98.9. 98.9. Win FM.
TDC Financial Services. We're here for you to help you make your dreams come true. Whether your needs are big or small, we'll support you with them all. TDC Financial Services. We are strong. TDC Financial Services. This is where you belong.
TDC Financial Services, where money is made easy.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
Welcome back to Inside the News right here on WinFM 98.9. I'm your host for today, Devon Cornelius. It is 11:51 a.m. We break at 12 for the headline news. Thank you so much for tuning into the program. We have Dr. Hazel Laws, Chief Medical Officer, here with us today. And the topic is respiratory infections, including COVID-19. Dr. Laws, we are in the home stretch. We are wrapping up. And I want to still go back to explaining some of the measures that one can use to prevent the flu.
Okay, so I think this may be the most important question of our
Yes.
interview, and I'm happy that you asked. So we at the ministry, we are encouraging the most vulnerable persons amongst us, including the older adults with the chronic medical conditions like diabetes, asthma, kidney disease, heart disease, to consent to taking the flu vaccine. Also, pregnant women to take the flu vaccine. As I said, the flu vaccine is available and accessible at all health centers in the Federation. Please remember, vaccines save lives. It reduces the risk of your picking up the flu, and it reduces the risk of severe complications of the flu. Now, I also must speak to the COVID-19 vaccines. They are currently out of stock, but we hope to get some additional doses at the soonest. Now, in terms of personal protective measures that one can adopt to protect us from the flu and COVID-19, these measures include: 1, adequate hand hygiene. Washing your hands after touching high-touch contaminated surfaces reduces your risk of picking up the flu and COVID. And yes, wearing a well-fitting face mask. I know persons do not like to hear me say this, but now that the numbers are going up, I am happy to see that there are a number of persons coming into the pharmacy and to the supermarkets with their face mask on. So a number of persons have restarted wearing their face mask, and I commend them. Because if you wear a well-fitting mask in a crowded space, it protects you from the flu and from COVID. I also recommend a mask when you're going onto the bus, public transportation. And yesterday I went to the airport to see my brother off, and I recommend that persons traveling, they really should wear a face mask because it protects you from the flu and the COVID. And the persons who are experiencing respiratory tract infection symptoms, they should really stay at home. They shouldn't be going to work or to school because it reduces the risk of the spread. And if you are well, you need to stay away from somebody who is experiencing respiratory tract signs and symptoms. And if you are experiencing such symptoms, you need to practice respiratory hygiene, whereby you cover your cough or your sneeze with a paper tissue napkin that's easily disposable, or in your elbow. You could do so in your elbow, because then you are protecting the droplets and not, from spreading to others. And if you are experiencing symptoms, get tested. The COVID test kits are available at the pharmacies within the Federation. You could do a home test, or you could go to the health center or the hospital to get tested.
Awesome. Thank you so much, Dr. Laws. It is 11:55 here in the studios of 1FM 98.9. Do you have anything else that you would like to share with the listening audience at this time?
Yes.
Awesome.
Okay, so a number of persons are experiencing respiratory tract signs and symptoms, and they're at home taking home remedies. I'm speaking specifically to the older adults with chronic underlying conditions. So those older adults with diabetes, asthma, heart disease, kidney disease. If you are experiencing respiratory symptoms and you are taking home remedy at home, you need to monitor yourself closely. I recommend that you call your primary care provider to have that provider help to monitor you for red flag signs. What are these red flag signs? Difficulty breathing, shortness of breath, chest pain, vomiting, diarrhea, not able to eat or tolerate food, irritability, or difficulty interacting cognitively with your peers, your friends, your relatives. These are some of the red flag signs. If you notice any of these, you need to be taken to the emergency room right away. So I'm speaking to the older adults with chronic underlying conditions. If you are fighting flu-like symptoms at home, I recommend you call your primary care provider to help to monitor you. And if you see any of these, if you're experiencing any of these red flag signs, you need to be taken to the emergency room.
Awesome. Thank you so much, Dr. Laws. It is 11:58 right here in the studios of WinFM 98.9. Basically, just 2 minutes before we wrap up. Again, thank you so much for accepting the invitation. I think you touched on every single thing that we wanted to talk about today. Again, for those of you who are just tuning in, we were on the topic of respiratory infections, including COVID-19. As I said earlier, a number of people have been coming down with the flu. And as you mentioned, I observed the same thing where people are now going back to wearing their face masks in public spaces, particularly on the bus and in the supermarkets and all of that. So people are aware, people are conscious of what is happening. And I remember during the COVID, it was being repeated. Personal responsibility.
Yes.
Personal responsibility.
So that's where we are at right now. Everyone, it's our responsibility to calculate our risk of exposure to the flu and COVID and take the necessary precautions. You know, the measures that I just listed.
Right.
Yes.
All right. Dr. Laws, we are out of time. Thank you so much for accepting the invitation once again. And I hope we can have... I think we may have to come back a second time.
That's fine.
If needs be.
I'm open
Awesome.
to that. Yes,
Awesome.
so call
Thank you
me
so much.
anytime. It was a pleasure.
Thank you.
And I enjoyed participating in your program. So all the best.
Awesome. Thank
for
you so much.
2023. Thanks
And
again
same
for
to
having
you.
me.
You're welcome. I know people are still saying it is the 14th, but
Yes,
they're still saying
Happy New Year. Yes.
All right. You were just listening to Inside the News right here on WinFM 98.9. That was Dr. Hazel Laws, Chief Medical Officer of St. Kitts and Nevis, and we were on the topic respiratory infections, including COVID-19. It is the top of the hour, so we'll take this break now for the headline news, and when we come back, we will continue Inside the News here on WinFM 98.9 for the second hour. So we'll take the break, and we will be right back. Again, thank you guys so much. I think this program was very much needed. A number of people have been asking about COVID-19 and flu and what's been going on. Dr. Laws was here today, and she was able to answer a number of questions and provide the facts, provide some details, some information as it relates to COVID-19 and the flu. So, in a nutshell, personal responsibility. If you know that you are experiencing flu-like symptoms, if you know you're not well, please stay at home. If you know that, this is a situation, you feel you have COVID, you feel you have the flu, you are encouraged to stay at home and contact your primary care physician. It is 12 o'clock. Let's take this break for the headline news, and we'll be right back. Stick and stay.
You found the sound. 98.9. Win FM.
We now bring you the headline news. The headline news is brought to you by Caribbean Alliance, KDP Enterprises, The Grange, and Carib Brewery.
Shipping your cargo shouldn't be a hassle. It can be as easy as a single call to Amerijet International, your worldwide cargo transportation solution. We provide all the services you need to ship your goods anywhere in the world, whether your shipment is fresh, frozen, large or small, alive or hazardous. You can count on Amerijet to deliver it safe and sound. Amerijet International, by land, sea or air, we get it there. For more information, visit us online at www.amerijet.com or call us at KDP Enterprises at 466-9595.
We are faced with tough decisions every day, but choosing the right home or motor insurance shouldn't be one. You need fast claim settlement from a company that's been rooted for over 31 years. And don't forget the A Excellent rating by AM Best. Make the intelligent choice. Caribbean Alliance Insurance. Reliable insurance that you can count on. Get a quote today for your home, motor, contents, and liability insurance needs, and make the intelligent choice. Caribbean Alliance. Tomorrow. tomorrow secured. Local agents, Dalil Walwyn & Co. Limited. Telephone 465-2631 or 469-5303 for the Nevis office.
Did you know that the Grange Healthcare Facility is the first purpose-built, non-governmental healthcare organization on St. Kitts? It's situated at Otley's, 7 miles east of Basseterre in beautifully landscaped surroundings. The Grange has a team of highly trained professionals and provides care that's rated as being comparable with UK and North American standards. The Grange offers varied accommodations to suit your individual needs, and our all-inclusive packages make the cost of care per hour the most competitive on the island. Services include convalescent care for all ages, daycare facilities for older adults, rehabilitation services, and training and continuing education for healthcare providers. For more information, call 466-5525 or 465-8020. Fax 466-8221 or email thegrangehealth@gmail.com or visit our website at www.grangehealthcarefacility.com.
With over a century of perfection behind the Mackeson name, a smooth blend with perfect balance and richness, it's no wonder Mackeson Triple Stout has a legacy of perfection. Enjoyed the world over. Introducing our new look with the same great taste. Mackeson. All hail the king.
Please drink responsibly.
With the WIN Headline News, I am Kevon Brown.
I am Devon Cornelius.
And I am Yulana Weeks.
Making the headlines.
Employees of the Eastern Caribbean Central Bank recognized for their excellent service to the governments and people of the Eastern Caribbean Central Union. Keon Primary School welcomes donations from nationals in the diaspora.
Now, the details.
The Eastern Caribbean Central Bank showed appreciation to its employees who, during the year 2022, provided outstanding services to ensure that the bank's thrust to transform the region through innovation and collective action was pursued. The employees were awarded under 3 categories: Star Award, ECCB Spirit Award, and Impact Award. The Star Award recognized individuals who, for the past year, exemplified the bank's mantra of service excellence, teamwork and truth-telling, accountability and results. Receiving the 2022 Star Award were Livia Burton Mark, Samora Cherubin, Lynette Griffin, Leon Irish Wade, Chanel James, Marvin Jones, Christopher Lord, Daniel Morton, Sonia Nader, and Robert Wilkin. The ECCB Spirit Award 2022 was presented to employees who consistently demonstrated ECCB spirit, served as ambassadors of the ECCB, went above and beyond their call of duty, and promoted a respectful, collegial, and supportive work environment. The recipients of the ECCB Spirit Award are Tessa Marius Gilbert, Cecilia St. Louis Jeremiah, and Daldria Penny. On the other hand, the Impact Award recognized employees or departments who created a system or initiative within their departments which positively impacted the bank's operations. The 2022 Impact Award was presented to Acklin Blaze and Prunella Charles Williams. Shermalyn Kirby, the acting director of the Corporate Relations Department, said the staff of the ECCB worked from home during the height of the COVID-19 pandemic and then worked on a hybrid telecommuting system as of April 2022. Despite the new reality, Kirby said the staff managed to give exceptional service to the people of the Eastern Caribbean Central Union.
The transition was met with mixed feelings. While some staff craved the camaraderie of face-to-face interaction, others had grown accustomed to the convenience and comfort of working from their homes every day. Nonetheless, providing the usual excellent service to the governments and people of the currency union was priority. Therefore, staff adapted, delivered, and continued to serve as ambassadors and to make positive impact on the operations of the bank.
Meanwhile, other employees were awarded for their long service to the Eastern Caribbean Central Bank and the Currency Union. Karina Phillips Summersall, Lydia Blanchard, Quechua Charles, Carol Pemberton, Janelle Lake, Leroy Parker, Jevon Wilkins, and Elizabeth Wayland were recognized for 10 years of service. Lyle Mark, Marissa Richardson, Maria Barthelme, and Cindy Paris Gilbert were recognized for 20 years of service. Selvin Ama, Akelia Doras, and Med Williams were recognized for 25 years of service, whilst David Doras, Beverly Edwards Gums, and Denise Williams Frank were recognized for 30 years of service. The Keon Primary School received hearty donations of academic supplies from nationals of St. Kitts Nevis residing abroad, following a request made by the school's Parents Teachers Association. The initiative was geared towards improving the quality of education and bringing relief to the families of students attending the school. As a result of the back-to-school drive, each teacher and student were gifted with their personal package of academic supplies in time for the start of the school term on Monday, January 9, 2023. The donations included but were not limited to notebooks, pencils, pens, crayons, erasers, sharpeners, highlighters, and glue. In an interview with WinFM, newly appointed principal Mr. Javan Cannonier welcomed the initiative and hinted that this type of project would be continuous.
The PTA at the Keon Primary School sought to ensure that every child at the institution had the necessary stationeries to assist them in their academic quest or journey. Hence, the initiative will not be a sole initiative. It will be continuous, as they recognize that learning is pivotal in the transformation of lives.
Cannonier expressed gratitude to the donors who contributed to the back-to-school drive and expressed his desire to receive further support.
There were a plethora of donors, of which we are indeed grateful. However, there were specific individuals on the foundation who spearheaded the initiative from the United States, namely Miss Corinne J. Phipps, Miss Jackie Allen, and Miss Blondina Thompson. As an institution, we are immensely grateful and we look forward to their continued support.
The Keon Primary School's PTA president, Mrs. Teresa Hamilton, officially handed over the donations to Principal Javan Cannonier and a student council representative.
In regional news,
what can be done about the rising price of groceries, gas, and energy? Many households have had to scale back cost of living expenses in order to stay in good financial standing. The World Bank has cut 2023's global growth projection as inflation persists worldwide. The bank expects global growth to slow to 1.7% in 2023. Despite the worldwide historically high inflationary rates, critics are demanding that the present administration do more domestically to provide further relief to help struggling families.
We're not blaming them for the inflation, that's not the point. What we're blaming them for is the very unimaginative, the very incapable and incompetent manner by which they are dealing with this rather important problem that is continuing to eat away at the very fabric of our communities.
The opposition United Workers' Party has joined the chorus of calls for more relief to the masses, especially at the pumps.
Why has the Prime Minister not reflected the decreases in the price that you have to pay per gallon at the pumps commensurate with the fall of oil prices on the market? We believe that this is a simple rip-off to the people of St. Lucia. This is what they call daylight robbery.
The retail cost of petrol declined by 70 cents this week. It should be noted that the government is absorbing high fuel costs with subsidies to the tunes of millions of dollars in lost revenue despite the rise in the price at the pumps globally. This means the cost of fuel would be even higher if the state was not paying for the petroleum products like petrol and cooking gas. UWP Senator Dominic Fede also underscored stagnant wages in the face of rising prices for consumers.
The Prime Minister failed to continue to buffer the lower income families and the vulnerable among us from the spiraling out of control prices that we see in everyday living. We see even the price of bread has gone up. Everyday items such as LPG gas are the highest that they have been in a very long time. Bus fares have gone up. And so life has become increasingly expensive for the people of St. Lucia. And this is while their salaries are not moving and keeping a pace.
The former tourism minister points to the price of the cost insurance and freight, CIF, he alleges can be adjusted to alleviate the burden on the private sector. He claims that post-pandemic inflationary prices have resulted in a 250% increase in cost of freight, which requires attention.
And what we are asking the government to do is to adjust the formula by which they charge the duties so that the rate of duties that are coming out of the shipping component can be reduced on the people of St. Lucia. This will not cost the government any revenue. In fact, by doing this and allowing this to go on for as long as they have raped all of us. They have raped our pockets.
Fede is calling on the incumbent to act with compassion and haste and provide more support to crush financial burden on less fortunate St. Lucian households. Solange Alfred, HTS News Force.
We now bring you these international reports.
Republicans in the U.S. House of Representatives launched their own investigation on Friday into the Justice Department's handling of improperly stored classified documents found at President Joe Biden's Delaware home and Washington think tank, and questioned whether his son Hunter had access. Top Republicans on the House Judiciary Committee demanded all relevant documents and communications between the department, the FBI, the White House, and Biden's attorneys. They said the Justice Department's appointment of Robert Hur as special counsel for the case this week raised fundamental oversight questions. Despite the letter, former Assistant U.S. Attorney Reid Schar, now a partner at Jenner & Block, said Hur has a reputation for being independent and fair.
He is perceived both within the department and more generally in the public sphere as someone who is not going to be particularly favorable to a Democratic president, but at the same time, someone of the utmost integrity who is not going to pursue anyone just because of a political affiliation.
Hur will investigate whether the classified records from Biden's time as vice president had been improperly stored, a situation that echoes a wider-ranging inquiry directed at former President Donald Trump's handling of classified documents. But legal experts say their cases are not the same. Trump resisted returning the papers, forcing an FBI search that turned up about 100 classified documents, and raising questions about whether Trump or his staff obstructed the investigation. The White House, in contrast, said Biden's attorneys found a small number of classified documents and turned them over after they were discovered. Schar said the criminal statute involved requires intent, and the comments by Biden's team is likely to signal the defense strategy.
I think that's part of an argument you can see coming, which is we didn't know we had these. We certainly didn't intend to take them. And as soon as we found them, we raised our hand and we tried to return them as quickly as we could. And that's all driven by trying to make clear that there was no intent to have these classified materials and therefore no violation of the statute.
The inquiry is a distraction for the Democratic president, who has criticized his Republican predecessor's handling of classified material and could cast a shadow over Biden as both men gear up for a possible 2024 election rematch.
Wall Street's biggest banks kicked off the fourth quarter earnings season with cautious outlooks on Friday, saying they stockpiled more rainy day funds to be ready for a possible recession, setting aside a total of roughly $4 billion to prepare for soured loans. JP Morgan Chase and Bank of America reported quarterly profit that beat estimates, while profit at Wells Fargo and Citigroup fell short of forecasts. But Reuters' U.S. finance editor Lenan Nguyen said it was the notes of caution about the U.S. economy that had the attention of investors.
The four banks that reported earnings today were basically in line with expectations of, setting up some preparations for a worsening economy this year. So while the banks reported results that were basically decent, what was really important was the commentary from the CEOs today, and the markets were listening for any sense that they were seeing worsening figures in their businesses or any trouble by the U.S. consumers. Right now, it sounds like U.S. consumers are holding up fairly well. They've still got money in their accounts, and a lot of people are still very well employed, and so there isn't this kind of disastrous tailing off of the economy in the consumer segment. But what the CEOs did mention was that they're very careful about what's to come. The outlook is extremely uncertain, and so they're flagging up a lot of these risk factors that could start to affect the economy in the later half of this year.
The risks highlighted by bank executives included geopolitical tensions as well as stubbornly high inflation, which has led to the Federal Reserve's fastest rate hiking cycle since the 1980s to cool demand in the U.S. economy. JP Morgan Chase CEO Jamie Dimon said U.S. consumers remained healthy, but that he didn't yet know the, quote, ultimate effect of the headwinds coming. Bank of America chief Brian Moynihan also acknowledged a, quote, increasingly slowing economic environment.
We're hearing the word mild quite a bit in mild recession, that the economic slowdown isn't going to be really, really catastrophic, that it's going to be a shallower slowdown. That remains to be seen, and they definitely hedged by saying there are many risk factors that could affect that outlook. But for now, the bank CEOs and executives, they are warning about more pessimistic scenario, but they're still not, kind of ringing any alarm bells.
Shares of the big banks were higher in afternoon trading, reversing declines in the morning. Morgan Stanley and Goldman Sachs report earnings next week.
Now, the family of a British-Iranian man says that authorities in Iran are preparing to execute him. Ali Reza Akbari was arrested in 2019 and sentenced to death on accusations of spying for the UK, which he denied. The UK has urged Iran to immediately release him. Well, Iran has executed 4 other men since December in connection with the anti-government protests across the country. The United Nations have said that Iran is weaponizing the death penalty in order to stamp out dissent. Well, we can discuss this further with my next guest who joins us from New York. It's Jason Rezaian, an Iranian-American Washington Post journalist. Jason, welcome. You spent 544 days imprisoned by Iranian authorities. When you are watching what is happening right now, it must be with an extremely heavy heart.
It's frankly chilling, Katja. I follow events in Iran very closely. I write about them for the last several years. I've been following cases of other dual nationals imprisoned, like Nazanin Zaghari-Ratcliffe and Morad Tabaz, Amicheh Ashuri, and others. And to learn about this case, Mr. Akbari, right now, it's heartbreaking. As you indicated, the UN says that Iran is weaponizing the death penalty. They've been doing that for a very long time. Now the world is paying attention, and I hope there's something that we can do about it.
Well, it's just important to stress and talk us through it, your first-hand experience, of course, because you're US Iranian national. This man is UK Iranian national, and yet Iran doesn't recognize dual nationality. So for them, they see them as an Iranian citizen. So anything the international community can do in terms of diplomacy, what happens?
Well, to be honest, they say that they don't recognize your nationality, but they recognize it very clearly when they arrest you and take you hostage and try and leverage you for concessions against your home government, which was the case in my imprisonment, the others that I mentioned, and many more throughout the past. So it's a very difficult quandary that the British government finds itself in. But they owe a responsibility to this man who's a citizen of your nation. Democratic countries have a specific responsibility and accountability to protect citizens, even when they're in hostile environments like Iran. So I hope that behind the scenes that things are happening, although we never know about those until someone is freed.
We have audio of Mr. Akbari saying that he was tortured, that he was forced to give a confession. What was your situation like in terms of your experience in Evin prison, the most notorious prison in Iran?
Well, I had different experiences. 1.5 years is a long period of time, but my wife and I were arrested at gunpoint from our home, abducted, handcuffed, blindfolded, taken to Evin prison, where we were thrown immediately into solitary confinement. I spent 7 weeks in solitary confinement. She spent 10 weeks in solitary confinement. The only times we were brought out were to be interrogated on accusations that were laughable if they weren't so serious and nefarious in the ways that they treated us. The threat of death and dismemberment loomed over the situation for the entire time. And then ultimately I was brought on into the Revolutionary Court, the same court where so many of these people have been handed death penalties. So, in a way, Iran's judicial system, especially what they call the revolutionary judicial system, is farcical. But the ramifications, the consequences for people, their families, entire communities are so destructive. And on the one hand, I'm glad that the international community is recognizing this, but it's going to be too late. Many people are at risk of being executed right now, including Mr. Akbari. And whatever we can do to raise our voices to compel the Islamic Republic to stop using this extreme measure as a tool of political repression, we have to do it.
Jason Rezaian, you spent 544 days in Evin prison. Thank you very much for just sharing your experience with us. And I know you write about this extensively in the Washington Post. Thank you so much for your time.
Thank you.
You were listening to the Win FM Headline News on 98.9. Our top stories were, thank you for listening.
That was the Win FM Headline News. The Headline News was brought to you by Caribbean Alliance, KDP Enterprises, The Grange, and Carib Brewery.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
Did you know that the Grange Healthcare Facility is the first purpose-built, non-governmental healthcare organization on St. Kitts? It's situated at Otley's, 7 miles east of Basseterre in beautifully landscaped surroundings. The Grange has a team of highly trained professionals and provides care that's rated as being comparable with UK and North American standards. The Grange offers varied accommodations to suit your individual needs, and our all-inclusive packages make the cost of care per hour the most competitive on the island. Services include convalescent care for all ages, daycare facilities for older adults, rehabilitation services, and training and continuing education education for healthcare providers. For more information, call 466-5525 or 465-8020. Fax 466-8221 or email thegrangehealth@gmail.com or visit our website at www.grangehealthcarefacility.com.
We are faced with tough decisions every day, but choosing the right home or motor insurance shouldn't be one. You need fast claim settlement from a company that's been rooted for over 31 years. And don't forget the A Excellent rating by AM Best. Make the intelligent choice. Caribbean Alliance Insurance. Reliable insurance that you can count on. Get a quote today for your home, motor, contents, and liability insurance needs, and make the intelligent choice. Caribbean Alliance. Tomorrow secured. Local agents, Dalil Walwyn & Co. Limited. Telephone 465-2631 or 469-5303 for the Nevis office.
Shipping your cargo shouldn't be a hassle. It can be as easy as a single call to Amerijet International, your worldwide cargo transportation solution. We provide all the services you need to ship your goods anywhere in the world, whether your shipment is fresh, frozen, large or small, alive or hazardous. You can count on Amerijet to deliver it safe and sound. Amerijet International, by land, sea or air, we get it there. For more information, visit us online at www.amerijet.com or call us at KDP Enterprises at 466-9595.
Found the Sound 98.9 FM.
People make the world go
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
Buying your medication is easy with City Drug Store's curbside pickup. WhatsApp our certified pharmacist at 662-8769 with your requests. For prescriptions, take a clear photograph and send for review. We will engage you in dialogue and then provide a quotation and link for payment. You can then pay via TDC's online payment portal. And once the transaction is complete, you'll be notified that your pickup is ready. Yes, it's that easy. Send your WhatsApp message to 662-8769 to order your medications today with City Drug Store's curbside pickup service.
People make the world go round.
Welcome back to Inside the News right here on WinFM 98.9. It is January 14th, 2023. It is 12:34 here in the studios of WinFM 98.9. I'm your host for today, Devon Cornelius. Thank you so much for joining the conversation. We will be taking your calls at 466-0989 or 762-0989. That is 466-0989 or 762-0989. In case you were wondering, the Chief Medical Officer, Dr. Hazel Laws, she was just on for the first hour. And for those of you who are just tuning in, the conversation was surrounding respiratory infections, including COVID-19. So she was just on for the first hour. All right, welcome back to Inside the News here on WinFM 98.9. I'm your host for today, Devon Cornelius. Again, thank you so much for joining the conversation. It is 12:36 here in the studios of WinFM 98.9. And again, thank you for joining the conversation. For those of you who are just joining the program, for the first hour, we had the Chief Medical Officer, Dr. Hazel Laws, and she was here to provide some information on respiratory infections, including COVID-19. As you know, a number of people have been coming down with the flu, have been experiencing flu-like symptoms. And so Dr. Laws took the opportunity to explain some of the preventative measures that one can take and some of the scientific data that they have at the Ministry of Health and some of the steps that they are taking to track and monitor the influenza. The phone lines are now open, and so we will be taking your calls. Let us head to the phone lines and we'll take our first call for this afternoon. Caller, good afternoon. You're on the air.
Greetings. Thanks for inviting us. Thanks for taking our call. We were with you from the first half of the program. Thanks for the information flowed. We would have asked the Chief Medical Officer a simple question pertaining to natural immunity. We would have asked her what percentage of our population, enjoys that, it's strange, with this, and it keeps happening over and over again, throughout history. The culprits, this thing is not in a vacuum. It don't just happen, corona, whatever, pandemic, whatever. And it is so strange that no culprit or culprits are dragged to the Hague, and people's lives. What is there any figure to persons who have died from this thing? Do you know?
From the influenza?
No, from the corona, the pandemic, or whatever they call it. Is there
yes, the latest number.
Yes.
I think Dr. Laws stated 43 or 46, but somewhere in the region of 40, in the 40 something. But I will have to check that to verify.
You mean for the federation? I'm talking about globally.
Oh, globally? No, I don't have any information with me right now. But the number
it would be interesting to know that, these is people's lives, and as I said, no culprits hijacked to the Hague. It's like it dropped out of the sky. That means it's God. The people in the Christendom faith will say it's the works of God, is prophecy fulfilling, etc., etc. But just like how the systems You know, a system is not in the vacuum. It's people put systems in place. Human beings that causes other human beings to go through unimaginable suffocations, even to the point of death. And these things just, you know. Thanks for the information and taking our call once more. Blessed love.
All right, again, caller, thank you for your contribution to this program. You're listening to Inside the News here on Win FM 98.9. Let me just correct myself. So, as it is, there have been 46 deaths, COVID-19 related deaths. 46 COVID-19 related deaths in St. Kitts and Nevis. And worldwide, there have been 6.7 million deaths. Let's head back to the phone line, so we'll take this call. Okay, we seem to have lost that caller. You can call us back at 466-0989 or 762-0989. That is 466-0989 or 762-0989. Caller, good afternoon. You're on the air.
Good afternoon to you, and greetings once more in Jesus' name, the only Savior of sinners, from their sins and from hell, and the second person of the eternal Trinity. Now, a lot could be said about respiratory diseases, including the coronavirus. But I want to mostly zero in on the COVID situation. Now, a lot of studies, they are now coming out concerning the COVID situation. And based upon the studies, we are being told that a lot of what was done to fight the COVID actually did more harm than good. And another thing is that we have known, based upon studies in the past and studies during COVID, that based upon the past where infectious diseases are concerned, where respiratory infectious diseases are concerned, and during the time of COVID, that mask is not that effective as people think. And especially for COVID, studies have shown that the COVID virus is more spread by aerosol than droplets. So because of that, masks are of very, very little help, if any at all. The only one that presents some degree of protection is the N95 mask. And even though it's not foolproof, but the other masks, like cloth and surgical masks and all those sort of stuff, are shown to be joke and very ineffective because of the size of the COVID virus and the fact that it is spread by aerosol and not so much by droplets. But it is also shown that people who are asymptomatic, and the biggest study was done in China, that they don't really spread the COVID virus. Those who spread it are those who are showing symptoms, not those who are asymptomatic. Not only that, many studies are now coming out on ivermectin, and there's a book that is slated to come out soon called The War on Ivermectin, coming out on Amazon, The War on Ivermectin. And it will show you, as I've read, that many studies have shown that ivermectin is very, very, very effective against COVID. Also, studies have shown vitamin D as well, very effective against COVID. And that if these things were implemented, instead of being fight down by Big Pharma and the doctors that are working with them, such as the CDC, such as those from the CDC and FDA and so on, the World Health Organization and so on, if ivermectin and things like vitamin D and hydroxychloroquine and that sort of, that study has shown that to be very effective. Those things were used early on in 2020, which we already know by then that they were very effective. This COVID thing would have been finished very, very early in 2020, maybe July at the latest, if so long at all. But a lot of people died from the COVID, and I think the numbers are much, much higher than they really are. But still, a lot of people who died from COVID. They could have been saved if the doctors and hospitals were giving them such things as vitamin D, hydroxychloroquine, ivermectin, and other things, and other stuff.
All right.
But because they refuse to give people these things and go against and go against more studies and saying that they don't work and condemn them, if there was instead of going along with the best studies and most of the studies, if they had applied these things, a lot of lives would have been saved that are now lost. And where the vaccine is concerned, where the COVID vaccine is concerned, many studies are now showing that they are causing a lot of problems, including myocarditis, which is heart inflammation. They're causing, it is believed that we are seeing a sharp rise in cancer because of them, and other sorts of infertility problems and all other sorts of. I even believe that the big increase in sudden death and in athletes on playing sports and that sort of stuff that are falling down and dying and that sort of stuff. It is even believed that there's a connection between all of that and the vaccine, because of the heart inflammation that the vaccines are connected to cause.
All right. Caller, thank you so much for your contribution. We want to take a short break to give a shout out to our sponsors. You're listening to Inside the News right here on WinFM 98.9. It is 12:46 here in our studios for today. And we will take a short break now to acknowledge our sponsors. When we come back, we will continue the program. Stay tuned.
WINN is 98.9. 98.9 is Win FM.
People make the world go
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
If you need protection, you need one who you can trust. To secure your investment, you need one who'll do you just. TDC Insurance, you're the one that you can trust. TDC Insurance, you're always safe with us.
TDC Insurance is your go-to insurance company for all your insurance needs. We take pride in offering you the best solutions and ensuring our customers are fully satisfied. TDC Insurance, we take good care of you, guaranteeing you peace of mind.
You're always safe with us.
People make the world go
Welcome back to Inside the News right here on WinFM 98.9. Let's head back to the phone lines and we'll take this call. Caller, you're on the air. Good afternoon.
Good afternoon, Devon. Hello?
Hello, caller. Good afternoon. You're on the air.
Yes, Devon. Good afternoon.
Yes, go ahead.
You know, Devon, your first caller says no one is being taken to The Hague for what we had from since 2019 until presently now. Let me say this, Devon. Death have a face. Life has a face. Everything is a duality, Devon. We have to wake up. Now, all that is happening to us in this our day, Devon, COVID and all that is now happening, death have a face and life has a face. Again, God have a face and Satan have a face, Devon. Follow me on this. The principalities that are in high places, Devon, the people who are operating this matrix, they are the enemy of God's chosen people. You now have to ask yourself, who are God's chosen people, Devon? Because if you look at who started warring, the Europeans have mastered the art of war and taking you back to World War I and II. And this thing that we now have in Russia and Ukraine, Devon. I have said before that we are at war. Why we are at war, Devon? We have something that the carbon copy don't have. That is melanin, among other things, Devon. I've worked in the hotel industry, from Marriott to Park Hyatt. And all of those hotel chains, when the Europeans come to our shores, they have genetic defects, Devon. They would put their information before they leave Europe to come here. And this information will be handed down to the executive chef of these resorts. I am gluten tolerant. I am lactate tolerant. Devon, I couldn't understand it. But I do know because of research. You see this thing that they put in the scripture said, thou shalt not hate, steal, lie? Well, who implemented it? Who invented stealing, lying, death, and corruption, Devon? Ask yourself these questions, see on a very serious level, and do your research. Because while they are exploiting what belongs to you and me, in the continent that our Creator gave us in Africa, I'm referring to the minerals and our raw resources, they put it in the scripture. They put it in the scripture, Devon, in the story with Esau and Jacob. Devon, they are the ones that are running this matrix. Because when you look at what the scripture said in Genesis, you shall eat of every herbs of the earth. The Creator provided everything for us before we were formed. But now the enemy have corrupted everything and we are in the matrix. And now we are sourcing our energy to the dollar. And this is when the enemy took, I don't even want to use the name Jesus, because that story being transposed from my African ancestors. But just for the sake of the Christian community, Devon, when the enemy took Jesus on the pinnacle and he shows him everything that glitters and asks him to bow down and worship me, we have forsaken what our Creator gave us in every herbs of the earth that we shall eat. And we are now servicing our energy to this system, this matrix of economics, the dollar. Peter Toshting a song said, the day the dollar die. Well, Devon, it is dying in many ways because we lost the queen, that wicked queen, and Pope Benedict and another pope. That system is crumbling, Devon. We as Africans are a collective. We were a collective in the beginning, and we will be a collective in the end, Devon. Wake up. Because all that is playing at us is coming from them. And they are the principalities that are running this system. And they are in high places. God have a face, Devon. Satan also have a face. Death have a face. Life has a face. Today, love has conquered hate because we are waking up, Devon. Love has conquered hate and life has conquered death. We are eternal. The carbon copy are not. They have an expiry date, and this is why they give us COVID and all the other sicknesses that are going to come. One of your callers mentioned something about vitamins, but look at the system. We are taking vitamins, but they are pushing genetic modified organisms and they are in our supermarket. So we are putting in vitamins and we are also intaking GMO. So we are always forever compromising our health. Thank you for hearing me.
And thank you, caller, for your contribution to this program. I wanted to share with you, the listening audience, Some news here from Trinidad and Tobago as it relates to their carnival. They say carnival on despite the rising COVID-19 cases. So known as the mother of carnivals, or mother of all carnivals, is on, and the government does not intend to institute any additional restrictions despite rising COVID-19 cases in Trinidad and Tobago. This was the word from the Prime Minister, Dr. Keith Rowley, although he still called for greater responsibility among the population with the new XBB 1.5 subvariant in circulation, and daily cases forecast to reach the high hundreds within the next 2 weeks on the current trajectory. Speaking during a media conference at the Diplomatic Center in St. Anne's, the Prime Minister justified the decision to continue with the carnival plan despite the rising infections. He said, quote, "We do not believe the situation warrants us to not have carnival, but we believe that it warrants us taking personal decisions about your exposure to minimize instances for requirement of healthcare delivery to you," end quote, he said. So carnival is on in Trinidad and Tobago despite the rising COVID-19 cases there. As I said, people are moving forward and living with COVID-19. Of course, not being reckless, but at the same time, you have to, there has to be personal responsibility. The government cannot care for every single person when it comes to the COVID-19 or this whole flu season that's going on right now, but it boils down to personal responsibility. The phone lines are open. Let us head back to the phone lines. We'll take this call. The caller, good afternoon. You are on the air.
Hey, good afternoon, Devon. Let me turn my radio off. Good afternoon. I must compliment you for inviting the CMO.
Yes.
To the program. Because what we have been having is all sort of loose statements. And all the conspiracy theories are out. Can they prove what they're saying? Weren't people dying before COVID? And the drug that my good friend Greg, I send my condolences on the passing of your stepmother, Mrs. Gill, and to you, rest of your family, your brother and sister, and the rest of the family. So my condolences. You will always, let me not say you, we. There are some of us who will always look for something to back up what we believe or what we think. The drug he's calling was never developed for COVID, neither COVID nor influenza. I think it was a war medicine, something like that. We make excuses, and for all of those of us who took the vaccine, we should be complimented, because it is the high rate of vaccination and the other immunity that was achieved by those who got it. Is why it is taking not a long story. A lot of us, since you say this happened, a lot of us put our lives on the line for those of you who thought that your life was more important than ours. In China, they have been saying that not enough people were vaccinated. That is why you're having the spread. Not enough. So not enough people immune. So when we come out of these lot of fancy story and this, I listen to them, on the thing, all the conspiracy theories. And as I told my friend Greg, for every theory there is a counter. So we have to examine the facts. That is why I am glad Dr. Laws came, because that question was put to another person, an advisor, who was giving all kind of flippant answers. She was able to answer you factually. You wanted information, you wanted numbers, you wanted what to do, what not to do. And while it is true about personal responsibility, How many of us are responsible? When you have people, oh, I don't care what this and I don't care what that, and nobody could tell me what to do. Those are the kind of people who put the population at risk. That's what it is, you know. You know, in economics, they assume the rational person, that the rational people make rational decisions. If you, for one, don't believe they got corona, and they don't have this, and how the white people trying to kill us out, you will never do anything to protect yourself and other people because you don't believe it. And all of your writers and your whatever say it ain't so. And you're more concerned about who sent it than the thing itself, the impact. Chinese are not black people, you know. And we say it starts in China. Are Chinese Caucasians? No, they're not considered so. You know, we got to be careful what we say. We make ourselves victims. We like this victim mentality. Everybody trying to take us out. COVID come to take us out. Well, why so many European Caucasians died from it? We have to ask ourselves these questions, you know. Because they sound good when you're in a black country. But are they logical? Good afternoon, my good friend, Journey. We're not victims, you hear me? We're not victims. And again I say, for those of you who understand the meaning of personal responsibility, it's not just personal. It is responsibility for the community. I prefer that statement. Because you got your own personal home, you got your personal responsibility, but you don't feel any for anybody else. Everybody walking and coughing and sneezing and spitting. Are they responsible? Are they taking personal responsibility?
Well, I would hope
and ignoring the others?
I would hope so. As I said, I see some people walking around with face masks and so, and people are gradually going back to
yeah, but you see,
using
somebody
the
else
measures.
spitting all over the place too, right? We learned that long time since school. They've got the cold and spit all over the place. It dries into the ground and the air blows it up. And for those who don't know vitamin D, you get from sunshine, eh? You know that, Devon, right?
Yes.
If you live in the tropics, you're getting it, go out in the sun. I mean, we're talking about, I say we must have civic responsibility, not just personal, because a lot of people don't even care for themselves. They take drugs, they smoke, they do crime. That's personal responsibility. So we have to take it serious and go beyond the narrow meaning. And all the conspiracy theories, it is people like myself and others who put themselves at risk to keep you safe. You hear me get that straight? It is the 88% who had the vaccine. Why you could be allowed talking outside of stupidness? Well, not stupidness, making the points you make. And remember, COVID is still here. Now, I was thinking also, Ganda, now, since people are testing themselves, because I think like in Barbados and so, what they ask you, when you test yourself and you are diagnosed as positive, you're asked to report it to the system, because as Dr. Law said, the numbers will always seem low when you have self-testing going on.
Right.
Which creates a delusion. Oh, maybe only got 10. Well, how many? And maybe they could ask the drugstore, not people name, right? About how many have you sold for the week. And then you can make trends and stuff like that, right? If you sell 50, because I don't think they don't have to go and tell the drugstore that they were positive.
Right, so you wouldn't necessarily know if they're positive or not. That's the thing.
I know, but you could make, probability based on what is going on. And a lot of you taking this COVID thing for a joke, And Brother Greg, again, aren't there any benefits to taking the vaccine? We hear all the story about all who dying. Well, they were dying all the time before Corona come. They were dying of the same causes too. And please, Please, I do not just take personal responsibility. I say it again, take responsibility for the people, the children, and those of you. If your child got a bad cold, as we say, got a bad cold, keep it home. Maybe they should encourage the schools to send home the children who turning up with his flu.
Mm-hmm.
Because in the States and so it is the children who are dying and the old people. All right then.
All right, Colin.
Have a good weekend.
You too, and thank you so much for your contribution to this program. Now, according to information from the World Health Organization, the COVID-19 dashboard globally, as of January 13, 2023, there have been 661,545,258 confirmed cases of COVID-19, including 6,700,519 deaths reported to WHO, that's the World Health Organization. As of January 6th, 2023, a total of 13,107,022,929 vaccine doses have been administered. Let's head back to the phone lines. We'll take this call. Caller, good afternoon. You're on the air.
Hey, good afternoon. How are you?
Hello, caller. You have to turn off the radio, all right?
No, I don't have the radio on.
Okay. I was hearing some feedback. Okay, go ahead now.
Okay. So how are you?
I'm doing good, thanks. What about you?
I'm doing good.
Awesome. Good to hear.
I hope you had a pleasant vacation.
I sure did.
And looking forward to all of your heart's desires being fulfilled for the coming year and beyond.
Thank you. Same to you.
Let me add to the list of issues that we're going to have in the future as a result of this vaccine. Now, it is said that this vaccine compromises the immune system. And if that is the truth, then it means that a lot of people are going to come down with acquired immune deficiency syndrome, which is AIDS. A lot of our young people in the near future and beyond will have difficulties conceiving. Men will be barren, female will be barren. I hope they're doing their research on all of this, so when time comes, they don't attack each other and say, you are the faulter, not me, and so on. There are persons now who are coming down with mental illness as a result of this vaccine. Maybe there was a precondition to it, I don't know. I really don't know. As for people dying before all of these things, if you're going to take something into your body that has an adverse effect, or it has a fatal effect on your system, is it fair to say, well, people were dying before? No, that person could have lived had that foreign substance did not enter into the body in the terms of food or whatever. That person would have lived. A lot of people with a lot of, as they say, pre-existing conditions, if it wasn't for the introduction of this substance inside of them, they would have been alive today. Have you noticed the number of people who are now dying at a very young age? Doesn't it seem strange around this time? People were dying all the time. But something is wrong with the frequency and the age. Is anybody investigating that, or did they know prior? And if this was not something that was terrible to the body, why is it persons were told by those who manufactured it or those interests, oh, they don't know, they can't tell you how this is going to affect the body. But at the same time, persons' livelihood was threatened that if you don't take it, you cannot eat. But they're telling you, they don't know. So how could someone be told this and still go ahead and take something that they don't know about. It was there all along. They knew. Now they can come out with the information because they have gotten what they wanted. Well, it's a sad affair. And who took it? They have already taken it. I mean, there's nothing they can do about it. I, for one, I am not going to encourage anybody to do it. I will not discourage anybody from doing it. The bottom line is everybody has his or her own decision to make regarding that. I cannot take something into my body and say I am protecting anybody else. Because when it came out first, it was said 70% vaccinated. That is all that is needed to protect the rest. That's what was said. So why then, in the end, that yardstick was removed and then they brought in variants, mutation, and because of that, whatever now cannot respond to what they are given or whatever, it's useless. So you now have to up. Come on. Even somebody with no brain or half a brain realizes that something is wrong or was wrong. Something was wrong. The bottom line is, this is about people's personal accountability. Personal accountability. They put out the information out there. They were telling people what will happen. Ain't nothing to do with a conspiracy or theories. There's no such thing as that. They put the information out there, and then they had another group come out to contradict it, and that is to cause confusion in people's mind. But they told you what will happen. And exactly what they say would happen is what is happening before our eyes. Mr. Moderator, you have a good day.
All right, caller, and thank you so much for your contribution to this program. I do appreciate it. It is 12 minutes past the 1 o'clock hour here in the studios of 1FM 98.9. And you're listening to Inside the News. I'm your host for today, Devon Cornelius. Thank you so much for joining the conversation. The phone lines are open and we're taking your calls. Let's head back to the phone lines. We'll take this caller. Caller, good afternoon. You're on the air.
Devon, it's me again. I would like to say some things quickly. First of all, to Johnny, is when Adam took the forbidden fruit, that is what brought all sorts of evils and wars and sin and death and all sorts of stuff into the world, with men of all quote-unquote colors warring each other, killing each other, and being evil and wicked to each other. It ain't nothing to do with soccer or race or anything like that. It's Adam taking the forbidden fruit in the Garden of Eden that bring all these evilness and wickedness into this world and sins into this world. Now, I also would like to say, yes, people has been dying all the time. The Bible yourself teach you that. But if you introduce something into a community, and after you introduce something into a community, the death rate rises a lot higher. Then, at the very minimum, it ought to send a red flag that there might be a connection with that new thing into the community and the increased death rate that is now being experienced in that community. That's how medicine works. That's how investigation works. I think it was either the swine flu or the bird flu, one or two of them. When they had the vaccine for it, and they find that after they vaccinated people started coming down with all sorts of sicknesses on an increased rate. They had to stop the vaccine because it was shown that there was a connection. And the increased sicknesses that people came down with was the red flag. That was the common denominator, and that is what researchers look for, the common denominator. And today, with the vaccine, for example, so some people were taking Pfizer to court the other day, and Pfizer asked the court not to release the document in 77 years as to what the results say according to the ill effects, side effects of the Pfizer vaccine. That's what Pfizer asked the courts to do. Don't release the documents until for 77 years. But the judge said no, and released the facts and released the documents, and there were pages of very serious terrible effects that Pfizer found out in the studies that are associated with their vaccine. And not only that, the COVID vaccine companies, before they give it to governments, they're asking governments, demanding that governments sign agreements that you can't sue them. So if your vaccine is safe and that sort of stuff, but why you can't sue them? Why they're demanding you sign agreements that you can't sue them? And that Pfizer was asking the government, the court not to release the documents until after 77 years, if everything was okay. Not only that, it is shown that a lot of sudden deaths are now being experienced. There's a book that come out on Amazon. There are a lot of studies in it called Sudden Death. And people, if you get a chance, you should check that out. It has always been dying suddenly, but there is a tremendous increase now. Now, Miss Henry, concerning Miss Henry think, apparently to me, that if the government says it, it is not conspiracy theory, it is true. But anything contrary to what the government or the official body say is conspiracy theory. When studies are coming out now to show that what the government and the official bodies have been saying is not true, and what others, including eminent scientists, cream of the crop scientists, that what they has been saying contrary and what studies are showing, that those to the contrary to the official bodies and so on, are what is true. That is what is coming out now in studies on that sort of stuff. And if you remember earlier on, Dr. Laws, Dr. Cameron Wilkinson, they were saying that the vaccine was giving 100% protection. Wasn't that conspiracy theory on their part? Because we now know that is nowhere near true now. But when they were saying it was giving 100% protection, wasn't that conspiracy theory? And even me, I think one time when they had the show and they were saying that, I already knew that studies were coming out that was saying, no, people are taking it and they are still doing it. And I think I tried to show them that and they refused to listen to me. Because once it can come from the official sources, it is quote unquote conspiracy theory. You see, we have to listen to both sides of the argument. Right now, countries like England, US, and that sort of stuff, most of the people who are getting the COVID right now and are dying from it, what they're finding out, most of them are people who have been back. And that natural immunity is better than the immunity, so-called immunity that is purportedly alleged that the vaccine gives. It is right now showing that nothing better than natural immunity, and the vaccines are leaky vaccines that don't really protect you. In Pfizer now said, when asked on the oath, well, I think one of the high people in the Pfizer company, when asked on the oath, if you are tested for concerning transmission, they said no, they said they ain't tested for concerning transmission. But yet when they were not on the oath, they were fooling people that they tested for transmission and they find it. At first they were saying 100% effective in preventing transmission. And now we know that is not true. And they're now admitting on the oath, I think it's in the US Congress or something like that, where they now admitted, no, they didn't test for transmission. So there's a lot to this story that a lot of people don't know, and a lot of people need to research, and a lot of people need to listen to both sides of the argument. And there's a lot more to go into.
All right.
But until another time.
All right, Carter, thank you so much for
God bless.
Your contribution to this program. Let's take a quick break to acknowledge our sponsors, and when we come back, we'll continue Inside the News right here on WinFM 98.9. I'm your host for today, Devon Cornelius. It is 18 minutes past the hour. Let us take this break, and we'll be right back.
Found the sound 98.9 FM.
People make the world
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib, it's the way we play. Drink responsibly.
TDC Financial Services, we're here for you to help you make your dreams come true. Whether your needs are big or small, we'll support you with them all. TDC Financial Services, we are strong. TDC Financial Services, this is where you belong.
TDC Financial Services, where money is made easy.
People make the world go
Welcome back to Inside the News. Caller, good afternoon. You're on the air.
Devon, are you hearing me?
Yes, caller, go ahead. I'm hearing you.
Devon, have you ever asked yourself this question, right? Why the talking snake did not give Adam what he called the fruit? Why a talking snake did not go to Adam first? Which in reality, when you look at it, it is Western civilization, because the scripture says that the Most High said to them when they were placed in the garden, he says, from the fruit of your loin you shall be blessed. Well, what is the fruit of our loin, Devon? The fruit of our loin is our offspring. For the serpent, the talking snake, for those who think it was a snake, because it said a serpent, the snake went to Eve, and what the snake did, it seduced, it beguiled Eve. It gave Eve his seed. The serpent, the talking snake that we read in the scripture, gave Eve his seed, and what it says, they saw they were naked. And then the God came down and called to them, and they hid because and God said, who told you were naked? And God passed judgment. He says, I shall put enmity between the seed of the woman and the seed of the serpent. You think it was a snake? Satan was there. Whatever you think Satan was standing in the midst of the garden. That was the fruit that Eve was never even to touch. So how do you relate to, I put enmity between the seed of the woman and the seed of the serpent, if from the fruit of your loin you shall be blessed? Our offspring. So therefore, Satan's seed represent the enemy of God. I mean, this thing is so, I'm not going to compel anyone, Devon, but just analyze what is in the scriptures. And for your Jesus caller to be saying that, I can't even remember what he said but yes, but look at history, the events, compare the events of the world and the scriptures. Are we supposed to separate these two? Because the events that have taken place, we were a collective, we were a body of people in our own space before these creatures came and invaded us. And they put it in the scriptures and tell us, Esau sold his birthright and the blessing, because they are exploiting us today. America and Europe on our right hand, and China just come lately in the crucifixion of the thieves that was crucified on the story of Jesus. We are the one that they are exploiting, and we are the one they are targeting, and they have reason for doing it because they know what they lack. They implement everything that they put in the scriptures, Devon. Lying, thieving, death, destruction. Look at them everywhere they go. Even NATO that they created. Look at what NATO have done in Africa, in Libya. And they even use our brother, Obama, to take out Gaddafi. We got to wake up. Thank you for hearing me.
And thank you, caller, for your contribution to this program. It is 25 minutes past the 1 o'clock hour here in the studios of 1FM 98.9. and you are listening to Inside the News. I'm your host for today, Devon Cornelius. Let's take our final call for this afternoon. Caller, you're on the air. Good afternoon.
Good afternoon, my friend. Devon, how you doing?
I'm doing good, thanks. What about you, man?
I doing good, man. I had lunch, you know. You had yet?
No, I'm going to get some lunch now, though.
Oh, you eating? You eating stesso? That's a natural diet. Anyway, correction for the caller before me. Obama ain't the one who take out Gaddafi. Anyway, let me move from that. Now, Devon, over the years, cigarette smokers, they have sued the company who makes cigarettes, so that the cigarette give them cancer, and they win the company that they sue. Well, why can't people who use gun to kill people sue the company who make the gun? Because they say that gun don't kill people, it's people kill people. But can the gun shoot somebody unless somebody ain't operate the gun? It's just like I buy a pack of cigarette and the cigarette there, and it wouldn't kill me if I don't light it and put it in my mouth myself. So I, as a person, put the cigarette in my mouth, and then the cigarette cause whatever cancer, and then I go and sue the company. But it ain't cigarette does kill people, so if me kill myself by putting the cigarette in there, because if I don't smoke the cigarette, it won't give me no cancer. So I want to know how come nobody could sue the company who make gun, because the same gun is being operated by me who got the gun. And if those who smoke the cigarette and sue the company and they win, well, therefore, we who got the gun and shoot people, we should be able to sue the company who make the gun. That is the way I see it. But nobody sue the company them yet to make gun and win. I don't know the reason why. And that's why so many people up and down the place with gun killing people. And those who using the gun just going out and shoot somebody because they have a little confrontation or whatever it is. You know why they're shooting the person? Because they know if they catch them, there is no penalty, no severe penalty to deter others from taking up a gun and going to shoot people. Before they get any severe penalty, they get all kind of different treatment what they never get when they're outside. That's why nobody stopped using gun. But if they had anything to deter them from using a gun and killing people, they would have never killed nobody. If they want to kill people, they would have hide it, that nobody could see them. But they go open day, open sunlight, bright sunlight in front of people and shoot. They don't care. Anyway, everyone, you have a good weekend, man. Thank you very much.
You too, caller, and enjoy the rest of your weekend. It is 1:29 here in the studios of WinFM 98.9. I'm Devon Cornelius. Thank you so much for your contribution to this program. Sorry. It is a beautiful Saturday here in St. Kitts and Nevis. And on behalf of all of us here at WinFM, I want to wish you guys a very peaceful and calm Saturday. Enjoy your weekend. Of course, back out to work on Monday. Thank you so much for tuning into the program for today. For those of you who joined in the second hour, for the first half, we had the Chief Medical Officer, Dr. Hazel Laws, and Dr. Laws used the opportunity to provide some information on respiratory infections, including COVID-19. As you know, a number of people have been coming down with the flu, and so Dr. Laws was here to provide some information on that. I want to leave you with an inspirational quote to, help you through your day, help you through the rest of the day, or help you through the week ahead. Sometimes people pretend you're a bad person so they don't feel guilty about the things they did to you. Sometimes people pretend you're a bad person so they don't feel guilty about the things they did to you. Enjoy the rest of your day and take care.
Danger and your presence could hamper emergency responses. Also, stay away from areas prone to landslides, low-lying coastal.
You ever hear Earthquake call and say, "Hello, Miss Lee, yes, it's me, Earthquake, I come in Tuesday around 10? No, sir. Earthquake does arrive unannounced, and when it come, it shake all sense and sensibility.